Shrikala, the medical officer, Department of Siddha, Government Hospital, Mahe, who's an enthusiastic Siddha physician who graduated from Shantagiri Siddha Medical College, Thiruvananthapuram. With 13 years of experience in Burma therapy and Siddha Mudra, she also specializes in pediatrics and women's health. We are privileged to have you all here, ma'am. Now, I'm glad to introduce to you all the face of Dr. Roshitha's Women's Health Clinic. Dr. Roshitha P., Consultant Women's Health, is a BNYS graduate from SDM College of Naturopathy and Yogic Sciences and an MD Gold medalist from Alva's College of Naturopathy and Yogic Sciences, who also holds a master's in clinical nutrition and dietetics. Ma'am herself being a firm believer and follower of naturopathy and yoga for more than 30 years, has 10 plus years of experience in healthy pregnancy and childbirthing, who specializes in pregnancy and women's health through diet and yoga therapy. Currently, ma'am is a visiting consultant at the Mahe Medical Center and Veda Happiness Center, Kasaragod. She and her team of doctors conduct specialized online yoga sessions for women on various health issues like PCOD, obesity, endometriosis, fibroids, and high-risk pregnancy cases as well. It's now time for the most eagerly waited moment, the logo launch of Dr. Roshitha's Women's Health Clinic.
And am I audible?
Yes, Dr. Roshitha, you are.
Yes, ma'am. Yes, ma'am. Ma'am, you are welcome to uncover the logo. I request ma'am for the logo launch.
It's beautiful, Dr. Roshitha.
Thank you, ma'am. Thank you, ma'am. Your blessings.
Yeah, it's wonderful. It just, it's connected too much to the nature, and whatever it's in your mind, it's come out very well in this logo.
Thank you, ma'am. So here actually there is an oval shape circle around this lotus, ma'am, that denotes the community. And then lotus means the purity and peace, as we all know, ma'am. And then woman represents each and every woman of our society. And then our medical symbol represents the scientific evidence-based scientific diagnosis and treatment.
Yeah, it says it all. The moment we look at it, we know what it is.
Thank you, ma'am. Shakti Anna, then we'll have ma'am's session, no?
Madam, do you have any slide presentation?
No, that wasn't told to me.
No, it is fine, not an issue, because I'll keep the background. I'll stop the share. Okay.
Yeah, you can keep the background as a logo itself. It speaks everything.
Shakti Anna, we would like to just invite Dr. Vasundhara, ma'am.
May I continue, ma'am?
Yes. I think
we now have
it's not here,
Dr.
Diksha.
Vasundhara. She's not here.
Dr. Shrikala is not here, I guess.
Okay. We now have Dr. Vasundhara to convey her wishes to her colleague. Over to you, ma'am.
Thank you so much, and many congratulations to Roshi for your wonderful new venture. I know you personally and how dedicated are you towards the system. I still remember the day I met you. I think in Gandhi Bhavan, you were carrying your baby with you. And that's the first time I was seeing you. And through the group and everything, I came to know about your work you are doing, the dedication you are doing. And I itself had conveyed your commitment to my patients. And the way they respond to me was that they say that thank you for referring Roshi ma'am, because she has many people, they usually come regarding their problem, how to overcome that, especially the amniotic fluid reduction. And you amazingly used to do it very well. And in this opportunity, I'm taking this opportunity to wish you deep from my heart for your new venture. May you take this towards a large community, because women are the backbone of the society. They need it, and especially the kids, which we say that they are the next generation, is very essential for the future. And congratulate you from my deep heart, and thank you so much for inviting me, and looking forward to work with you. Thank you.
Thank you, ma'am.
May I now take this opportunity to welcome Dr. Lakshmi Priya, consultant obstetrician and gynecologist, to deliver a talk on importance of yoga and healthy lifestyle on women's health. Over to you, ma'am.
Thank you. So before starting the session, I would like to really congratulate and thank you for honoring me so much to call for this launch event. And to say something about Dr. Roshitha, she's as I haven't been like personally, we have not been in touch, but through phone calls and online, we have seen a lot. But I have seen her as a very, very dedicated woman. That too, especially in terms of naturopathy. See, not everyone can practice naturopathy. Only those who are really feeling the inner meaning of it will be able to deliver a beautiful meaning of it to the outside society. She is one such person, and I've heard a lot about her through the patients who come to me. The people who have been referred by her, they always keep talking very high about her. Only through that sense, I knew a lot about her. And she tries her level best to heal a woman's body. That's one great thing which you are doing. And this launch of this Dr. Roshitha's clinic will be a very great success, because your heart is so pure and your commitment towards the healing of a woman's body is also very nice. So when we come to see about the yoga and lifestyle, in healthy lifestyle in terms of women's health, see, nowadays the women is a beautiful creation of this earth, but we are exploiting ourselves in a very different way. We don't really understand a woman's body is very tender, but at the same time it is also very strong. We need to really focus on a woman's health, because only if the women's health is fine now, the next generation will be very great. If women's health is not taken care of right now, obviously the next generation is going to be a disaster. And the way she handles a women's health through yoga and healthy lifestyle, which is very, very mandatory in the current generation, which wasn't a reality. I mean, in a couple of generations back, the women were very, very healthy. They were following a very beautiful lifestyle, and not much of the persons were really having a health issues. But today, right, starting from PCOD and infertility and endometriosis and whatnot, every woman is down with this problem. And a lot of women take that pain and they think it is very normal to have such a pain, but not so. Every woman can be much, much healthy than what we are now. We are exploiting ourselves in the name of modernization, taking a fast food kind of lifestyle and looking after everyone and least to giving importance to ourselves, or something which we have to really work on. In a way, like rather than depending on chemicals like medicines, it is best you people take up yoga and a healthy lifestyle to have to create a better new generation is what we all want it to be. So Dr. Roshitha's clinic will be a blast. I wish from the bottom of my heart, since she is a practitioner of naturopathy, she depends on all the Panchapudas to create heal a woman's pain. So the entire nature and all the Panchaputas will be with you for your new career to go ahead. And I wish you all very success. And I wish to be a part of this success in whatever way possible.
Ma'am, thank you. Thank you so much.
So you are already doing wonders, and I want you to do even more wonders to every woman possible in this world.
Thank you, ma'am.
Thank you. Thanks a lot for inviting me for this event.
Thank you, ma'am, for your insight. We have now come to the end of the session. So for the same, I request Dr. G. Diksha Prasad to propose the vote of thanks.
Good evening, all. On behalf of Roshi Group, it's my privilege to propose the vote of thanks on this memorable occasion. My heart fills with a lot of gratitude and respect for our distinguished chief guest, Dr. Lakshmi Priya, for not only sparing her invaluable time for us, but also for enlightening us with her commendable talk on women's health. I also express my thanks to our guests, Dr. Sushama, Dr. Sheba Nasim, Dr. Vasundhara VR, and Dr. Shrikala MP for honoring this function with their presence. Thank you, doctors. My sincere thanks to Dr. Shakti Vijayan for organizing this session. Thank you, sir. Furthermore, let's have a special recognition to our logo designer, Mr. Adarsh Prem. And this vote of thanks would be incomplete without expressing my gratitude to Dr. Diksha Gaudayu for being an excellent MC. Thank you, Diksha. Last but not the least, I want to thank you all for your significant presence. I'm Dr. Diksha Prasad. Thank you, one and all.
Thank you, everyone.
Thank you.
Thank you, Roshitha. We are looking forward for your building up of a bigger hospital rather than this logo launch. Hope this clinic grows bigger and bigger.
Ma'am, we'll start. Yes, yes. Ma'am, our clinic will start functioning in the first quarter of this new year.
Okay.
Yeah, slowly. This is the first step, ma'am.
Always baby steps lead to a bigger ocean. So we will always be present with you for the next new hospital, whatever is going to come in the future. And obviously, it is not a distant dream. For the dedication and the commitment you have for this naturopathy and yoga, obviously you can do wonders in it.
Thank you, ma'am.
And I'm also happy to be a part of your team.
We are happy to have you, ma'am.
Yeah, okay.
You have taken given time. One second.
ma'am, we can disperse, right? I mean.
No, the logo launch is over, but we are yet to cover the awareness talk by Madam. Diksha, can you hear me? Hello, Diksha.
Hello, ma'am.
Yes, Roshitha.
Ma'am, your awareness talk.
Just few seconds, I'll do it.
Yes, ma'am. Yes, ma'am.
Okay, participants, kindly wait for the talk on awareness regarding pregnancy and natural methods of healing, yoga, nature cure, etc.
Yeah. Let's start, and let it not be a lecture. I want, if possible, to have a mutual communication it's better to have a better insight on that. So nowadays, like, I'm seeing a lot of women who are into a lot of fears because of the modern society, which was not there in the previous generations. So be it either birthing or any gynec issue, women are always driven with fear. And I have heard from the integrative approach, like working with Ayurvedic physicians and yoga physicians, what I hear is like any strong emotion like anger, fear, or all these things are the starting point of any disease. Any psychological issue which is strong enough can lead to a physical issue, and vice versa. When there is a physical issue, it can lead to a psychological issue also. But the worst part is that most of the times, all these things in case of a women is very much underestimated and under addressed also. They think it is also a part of the normalcy. So when a woman complains of certain small symptoms, either we ignore it, or we don't have time to tackle it, or we don't have really time to sit and talk with them what is bothering. And nowadays in the modern medicine, what we practice, see, it is always like running, and we are not sitting and talking and addressing the real complaints of a woman who is suffering. But people like Roshitha and many naturopathy physicians whom I am associated with, they take their time to address what is starting point of all these suffering. See, in the modern medicine, what we see is we see only the symptoms. If there is an endometriosis, there is a pain, there is a subsequent infertility, and what so on. All these health issues are part and parcel of endometriosis. But why is this women starting this kind of endometriosis is not being addressed at all? So in the modern medicine, the symptoms are given we give medications for the symptoms, and the pain just goes on for that temporary moment. But the thing that caused the symptom is never being addressed. All these things can be addressed only by means of the Indic sciences, is what I've seen in my experiences. Like the entire pathophysiology, when we understand, the starting point is elsewhere, the presenting point is elsewhere. For a woman, when you take, for example, a person is presenting with endometriosis, the real cause for the endometriosis may not be there itself. There is something else which has gone wrong in the metabolism, which is causing this thing. Just curing that error will subsequently cure the endometriosis symptoms, is what Dr. Roshitha is doing. She works on the basic Panchabuddhas. So what has gone wrong in her system is being first addressed, and then the subsequent symptoms automatically gets dissolved, is what I'm seeing the persons whom practicing Ayurveda or yoga or Siddha, all these physicians go in this approach rather than the modern medicine, which looks at the symptoms and never on the cause that is treating this, that is causing these symptoms. I wish I had taken really a different science, an Indic science rather than MBBS, because that is giving a better connection to heal the person rather than just giving medications. And in a way, Dr. Roshitha is blessed to have such a science with her, and she's also doing a wonderful job in that. And why are women's health is very important. See, as I said, women is a beautiful creation of this world, and she's the only one who has the privilege to create another life. If her metabolism, her mindset, her stability emotionally or physically is disabled, the future generation, you can't expect a healthy child who is emotionally and physically healthy. You can't expect such a child to come out of that very women. So it is our real duty to take care of this women, be it a small problem or a bigger problem. It has to be addressed from the root cause. So it is not just the chemicals which can cure her, it is her lifestyle and her day-to-day dinacharyas that has to be addressed. Only then she can have a proper healthy life in her future. So yoga, as I knew for the past few years, I've been practicing yoga with one of the a friend of Dr. Roshitha. So, it keeps the body really energetic, and the metabolism is perfect with the practicing yoga. It's just not a physical exercise. People used to come and ask me for a PCOD problem. Is it okay to go to the gym and practice everyday workouts? Will it decrease my weight? And I've been doing this for a few months, but it is not happening. The very reason is doing a workout in the gym or something maybe your bulk can increase, your fat may burn, but that is not the reason why you are having this problem. There is some metabolic error which can be corrected only by means of a yoga asana. Every yoga asana has an inherent meaning in it. Why we do this asana, what is happening to the body is something which we have to realize. Each asana has a meaning. When we do this, it addresses a pineal gland, it addresses a thyroid gland, it stimulates this gland, it corrects this system. All these things are being taught by our ancient people, which are being brought to reality by physicians like Dr. Roshitha. So rather than just like that doing any physical workouts, if women are trained to do a yoga every day, at least 30 minutes, their lifestyle will be wonderful with all these yoga if they practice. And second thing, a healthy lifestyle. The modern day lifestyle is very pathetic, is what I would say. Like that too, especially IT people who keeps running round the clock. And also they never have this body clock mechanism set. They're not into a routine pattern. They work in the nights and they are awake in the days, untimely food. All these things are reflected in various kind of diseases in their body. Like PCOD, severe dysmenorrhea, always popping up pills and coming with varied diseases like autoimmune disorders, thyroid issues, which are very common nowadays, which we see every time, and lot of diabetics during pregnancy, lot of hypertension during pregnancies. All these things are very much related to their lifestyle and diet, which has to be addressed first and foremost. So this lifestyle modification is, they should start right from the childhood. No, it's not that after they become a woman, when they are planning for the pregnancy, that minute when we try to change, I'm not saying that we shouldn't do, but I would suggest that all these things should be started right from before puberty. We have to teach them what is the right thing to do. We have to bring them a healthy lifestyle. In that case, when they reach the term like their body is ready to have a baby, they will be in a perfect life, sync with the nature to create such a life inside. So all these daily lifestyle modifications, I would suggest Dr. Roshitha to do some frequent workshops or any talks on what is the proper lifestyle modification that we have to adopt for the pre-pubertal age group, for the pubertal age group, and for the pre-pregnancy kind of thing. Like nowadays, the puberty age group is even very much preponed. 9-8 years girls are attaining puberty, which is not the right thing to do. But because of the lifestyle and the modifications, because of the non-vegetarian things and fast foods they are consuming, their entire body is working a little faster. As much as they attain the puberty earlier, the aging is also earlier, is what we have to really understand. So these modifications are something which we have to really work on it, and we have to correct these things so that we create better health for the women, for her to create a better future generation. And most of the times the women care for the other people, husband, family, kids, and they fail to take care of themselves. They have time for everything. They do everything for them, but they don't even have a me time. At least 30 minutes time for themselves is something which they have to really adopt for them to run along for the entire day. So this is something which we have to teach them, we have to educate them, we have to make them understand what is going wrong in their system. So, but they come very late to us, they think bleeding is very normal. Excess bleeding is also very normal. They hesitate to go to the doctor. And sometimes they feel if we go to the doctor, if they suggest something, who will take care of the family? All these social issues are making them come very late to us in a situation where we have forced to give some emergency treatment like surgery and so on. So we should educate them whenever something is going wrong. They should approach the doctor a little earlier, and they should also take some remedies in terms of diet modifications and yoga rather than jumping into really tests and investigations and surgeries at the earliest. Anything can be cured by the nature itself. Body has the inherent capacity to heal, but they don't know how to heal it. And that is where the role of doctors like Roshitha come in. They really help them how to heal the body. Everything, see, only we are humans are the only person who depend on chemicals to heal themselves. Not any other living organism in the body and the world, they don't depend on any chemicals. If an animal is not doing well, it will go search a leaf, it will eat and it will vomit and it will become all right by themselves. They birth easily in the jungles. But the same doesn't happen for the humans. We think that we are super brainy and we always depend on chemicals, we always depend on surgeries for anything. Instantly we want something to rectify, remedy, but that is not the case. Everybody has the capacity to heal, and with the right directions from the right people, if you practice a real good yoga and proper lifestyle when they practice, they can live a very healthy life. See, Ayurveda is a science which I am closely associated with for the past few years. That is a science that should be practiced when you are well, not when you are in a disease. That is something which will prevent you from getting a disease, not after getting into a disease, is what I've understood in the long run. So this is nothing but, so all these things, even yoga and lifestyle and Ayurveda kind of sciences will help you lead a healthy life. Rather than getting into an illness, then coming back is not the cup of cake. We should understand that we women also are sometimes very, we don't care for ourselves. We keep running around. We keep looking after the patients, but we should also take our time to look after ourselves also. When we as women can look after ourselves, we'll be able to take care of the family and the society in a better manner. So I would suggest every woman, please spare some time for yourself, and you should educate the same to every woman who comes to you. Let's all work together to create a society which is very, very wealthier for women. And in that sense, we'll also create a better futuristic children who are much healthy emotionally and physically. Thank you.
Thank you, ma'am.
Thank you, Dr. Roshitha.
I will keep in mind.
I value your sciences a very, very great way, because we use some synthetic drugs to, treat people, but you are the one who use natural things, like something is in the nature, everything is in the nature. Only thing is we don't know what to take and when to take, how to take. So this is the way, the only way which can connect the nature and the people who are suffering is you. You are the only one who can heal the people's pain. And in that sense, you make many women smile. Healing pain is not so easy, and you're doing it in a very beautiful way with the help of the nature. And this nature's support will always be with you in healing people.
Thank you, ma'am. Thank you.
Thanks a lot.
Yes, ma'am. A word to everyone, please check NA Hospital, my birthplace, NA Hospital website. You can see beautiful stories there. Follow their Insta page to see how beautifully Dr. Lakshmi Priya ma'am handles pregnancy. Like I can share one small story of one of my patient. She was advised C-section, but she didn't wanted to. And then that day I called Lakshmi Priya ma'am and asked, ma'am, can I send to your hospital? Will you take it? At I think at late evening I asked. She said, she immediately said, yes, we'll do our best. And then she had a very beautiful natural birthing last year. Now the baby is celebrating 1 year. So that day I can never forget, because it was a high risk pregnancy and it was very beautifully managed by Dr. Lakshmi Priya.
So, but in that sense, I would also like to add, see, if it is not because of you, you know, just like that, a person cannot trust me and travel, you know, the patient traveled overnight. She caught a train in the midnight and she reached us in the early morning. And without even knowing who I am, and the patient has not even seen my face, but it's only for the face of Dr. Roshitha and her words, she trusted me. The trust is put only by you. So I would really, this credit, everything, even the birthing credit goes to you and not me, because you have built up such a courage in her. See, she came with such a positive thing. She was very sure and very positive that she would only deliver naturally. And only thing is, we did a little help in that. That's it. But the entire credit goes to you for that patient who birthed it beautifully.
Thank you, ma'am. Shakti Anna?
Ma'am, we have just been showing your webpage. This,
yeah,
this program is also going.
Dr. Shakti.
Yeah, ma'am, this program is also going live on YouTube, which I accidentally broadcasted. I didn't know I could do this before.
Okay.
So it's going live, and I'm very happy to have been, very near to you. Actually, I can come and meet you anytime.
You're almost most welcome. You are one person whom I really admire in a way. Like, you're more into teaching a lot of things to people, and your passion for teaching was something very amazing. And you're someone much different from the people I meet, you know, our ideologies sync. That is what I felt when I spoke to you. We were like speaking for almost an hour that day, I believe.
Yeah. Yes. Thank you, madam. And even my senior came from Chhattisgarh in North India, because he saw you talking in our classes. So he brought his wife 2 weeks before the due date, and it was very surprise for us.
Delivery. Yeah, after that,
delivery
in a couple of
just
days,
2 days.
Delivery happened.
Yes.
So he was very happy.
We are relieved that we can refer somebody to you. People who are very much into naturopathy, they do not have any good place. So we are actually fortunate to have known you through Roshitha. So we can very easily refer to you. Thank you, ma'am.
You can also be a part of my birthplace team. You can come anytime. We are welcoming you a lot.
Sure. Thank you, madam.
And your senior said one beautiful thing which I can never forget after the birthing. I didn't know birthing is so easy. Actually, I said birthing is easy. Only people make it more difficult.
Yes, right. Thank you, madam. Thank you so much. And,
thank you, Shakti Doctor. We will visit you soon at Kasaragod, Dr. Roshitha, and we also welcome you to my birthplace.
Sure, ma'am. Sure, ma'am. I'm coming soon.
Yeah, I heard. I'm also waiting to meet you soon.
Shakti, Dr. Srikala is here, I guess. Srikala?
Hello, doctor.
Yes. Sriku, സംസാരിച്ചോളൂ.
കേൾക്കുന്നുണ്ടോ?
ഉണ്ട്.
ഓക്കെ. ഇന്ന് ഡോക്ടർ റോഷിതയുടെ വിമൻസ് ഹെൽത്ത് ക്ലിനിക്കിന്റെ
Government Hospital, Mahe, who's an enthusiastic Siddha physician who graduated from Shantigiri Siddha Medical College, Thiruvananthapuram. With 13 years of experience in Varma therapy and Siddha Mudra, she also specializes in pediatrics and women's health. Welcome you, ma'am.
Thank you. എല്ലാവർക്കും നമസ്കാരം. ഇന്ന് ഡോക്ടർ റോഷിതയുടെ വിമൻസ് ഹെൽത്ത് ക്ലിനിക്കിന്റെ ലോഗോ ലോഞ്ചിൽ പങ്കെടുക്കാൻ പറ്റിയതിൽ സന്തോഷം. അതിൽ തന്നെ മോഡേൺ മെഡിസിനിലെയും ഇന്ത്യൻ സിസ്റ്റം ഓഫ് മെഡിസിനിലെയും കുറെ ഡോക്ടേഴ്സിന്റെയും കൂടെ ഇരിക്കാൻ പറ്റിയതിൽ കൂടുതൽ സന്തോഷം. റോഷിത ഡോക്ടർ പുതിയ ക്ലിനിക്ക് തുടങ്ങുന്ന പറയുമ്പോൾ ഞാൻ വിചാരിച്ചു എന്തിനാണ് ഡോക്ടർ ഒരു വിമൻസ് ഹെൽത്ത് ക്ലിനിക്ക് തുടങ്ങുന്നത്? ഇപ്പം ജെൻഡർ ന്യൂട്രാലിറ്റിയും ജെൻഡർ ഇക്വാലിറ്റിയും വരെ ഡിസ്കസ് ചെയ്യുന്ന സമയത്ത് എന്തുകൊണ്ടായിരിക്കും ഡോക്ടർ ഒരു വിമൻസ് ഹെൽത്ത് ക്ലിനിക്ക് എന്ന് പറഞ്ഞത് കുറച്ച് ചിന്തിച്ചു എന്ന് പറഞ്ഞാൽ പ്രകൃതി നമുക്ക് എല്ലാവർക്കും തന്നെ തരുന്ന സൂര്യപ്രകാശത്തിനും ശുദ്ധവായുവിനും ജലത്തിനും ഒന്നും ഒരു വിവേചനം ഇല്ല. എന്നുവെച്ചാൽ നമ്മളത് സ്വീകരിക്കുന്ന രീതിയിലാണ് വ്യത്യാസം വരുന്നത്. നമ്മളത് സ്വീകരിക്കുന്നതിലെ കൂടുതലും കുറവും കൊണ്ടാണ് നമ്മളുടെ ആരോഗ്യസ്ഥിതിയിലും വ്യത്യാസം വരുന്നത്. പ്രകൃതി നമ്മളോടൊന്നും ആരോഗ്യത്തോടെ ഇരിക്കാൻ പറയും, പക്ഷെ നമ്മളെ ആക്ടിവിറ്റി കൊണ്ട് നമ്മളുടെ ആരോഗ്യത്തിന് നശിപ്പിച്ചു കളയാം. തമിഴില് തിരുക്കുറൽ എന്ന് പറഞ്ഞ ഒരു മഹാഗ്രന്ഥം ഉണ്ട്. അതില് ഹെൽത്തിനെ പറ്റി ഫുഡിനെ പറ്റിയൊക്കെ പറയുന്ന ഒരു പാർട്ട് ഉണ്ട്. അപ്പൊ അതില് പറയും, മരുന്തന വേണ്ടലാം യാക്കൈക്ക് അരുന്തിയത് അറ്റത് പോറ്റൂണിൽ എന്ന് പറഞ്ഞാൽ നമ്മൾ കൃത്യമായി ദഹിക്കുന്ന കൃത്യമായ സമീകൃത ആഹാരം കഴിച്ചു കഴിഞ്ഞാൽ നമുക്ക് വേറെ മരുന്നിന്റെ ആവശ്യമില്ല. അല്ലെങ്കിൽ നമ്മൾ കഴിക്കുന്ന ആഹാരം തന്നെ ഔഷധമായിട്ട് പ്രവർത്തിക്കും എന്നാണ് പറഞ്ഞേക്കുന്നത്. അപ്പോ നമ്മള് സ്ത്രീകളെ ആരോഗ്യം പറയുമ്പം കൂടുതൽ നമ്മൾ ചിന്തിക്കുന്നത് റീപ്രൊഡക്റ്റീവ് ഹെൽത്തിനെ കുറിച്ച് പറയുമ്പോഴാണ് വിമൻസ് ഹെൽത്ത് എന്നുള്ള പ്രോസസ്സ് പറയുന്നത്. ശരിക്കും പറഞ്ഞാൽ പ്രത്യുൽപാദനം വളരെ നാച്ചുറൽ ആയിട്ടുള്ള ഒരു പ്രോസസ്സാണ്. നമ്മുടെ ശരീരത്തിൽ നടക്കുന്ന ബാക്കി എല്ലാ ജീവൽ പ്രവർത്തനങ്ങളും പോലെ തന്നെ നാച്ചുറൽ ആയിട്ട് നടക്കേണ്ട ഒരു സാധനമാണ് പ്രത്യുൽപാദനം. എന്നാല് ഇന്ന് എന്ന് പറയുമ്പം ഒരു കുട്ടിയുടെ ആരോഗ്യം ഏറ്റവും അധികം നിർണ്ണയിക്കപ്പെടുന്നത് അതിന്റെ കരുവിൽ നിന്നാണ് സിദ്ധയിൽ പറയാം. അത് ആദ്യത്തെ ഏകകോശമായിട്ട് അമ്മയുടെ വയറ്റിൽ കിടക്കുമ്പോൾ തന്നെ അതിന്റെ ജെനറ്റിക്കൽ ഹെൽത്ത് തീരുമാനിക്കപ്പെട്ടു. പക്ഷെ അവിടുന്ന് അങ്ങോട്ടുള്ളത് അമ്മയുടെ ആരോഗ്യമാണ് കുട്ടിയുടെ ആരോഗ്യം. എന്നിട്ട് ആ വരുന്ന കുട്ടി, അതൊരു പെൺകുട്ടിയാണെങ്കിൽ അതൊരു ആർത്തവാരംഭ കാലം തൊട്ട് തന്നെ അതൊരു നാച്ചുറലായിട്ട് നടക്കേണ്ട പ്രോസസ് ആണെങ്കിൽ കൂടിയും അന്ന് തൊട്ട് അത് രോഗിയാവുകയാണ്. അന്ന് തൊട്ട് ഒരു ഡിസ്മെനോറിയ, ഒരു ആർത്തവ വേദന, അല്ലെങ്കിൽ ഒരു PCOD, എന്തിന് ഗർഭകാലം തൊട്ട് സുഖപ്രസവം വരെ ഒരു മെഡിക്കൽ എമർജൻസി ആയിട്ട് മാറിക്കൊണ്ടിരിക്കുകയാണ്. സുഖപ്രസവം എന്ന് പറഞ്ഞു കഴിഞ്ഞാൽ ഇപ്പോഴത്തെ കുട്ടികൾ നമ്മളെ ഇങ്ങോട്ട് പറയും, എന്ത് സുഖമാണ് പ്രസവത്തിന് കിട്ടുന്നത് എന്നാണ് ചോദിക്കുന്നത്. കാരണം അതും ഒരു സർജിക്കൽ പ്രൊസീജിയർ, ഒരു മിനി സർജിക്കൽ പ്രൊസീജിയർ ആയിട്ട് സുഖപ്രസവം വരെ മാറിക്കൊണ്ടിരിക്കുകയാണ്. പക്ഷെ ഇതൊക്കെ വളരെ സിമ്പിൾ ആയിട്ട് ശരിയാക്കാൻ പറ്റുന്ന കാര്യമാണ്. നമ്മള് ജസ്റ്റ് കുറച്ച് ഭക്ഷണക്രമം, കുറച്ച് എക്സസൈസ്, യോഗ, ഇതൊക്കെ വെച്ച് വളരെ എളുപ്പത്തിൽ പരിഹരിച്ച് വളരെ ലഘുവായി കൊണ്ടുപോകാൻ പറ്റുന്ന ഒരു ജീവിതമാണ് ഒരു സ്ത്രീയുടെയും ജീവിതം. അപ്പൊ അതിനെ പറ്റിയിട്ടുള്ള അറിവില്ലായ്മയാണ് നമ്മളുടെ അസുഖത്തിന് കാരണം. ഐ തിങ്ക് റോഷിത ഡോക്ടർ ഇസ് ദ ബെസ്റ്റ് ഇൻ ഇറ്റ്. എന്ന് വെച്ചാൽ ഡോക്ടർ ഞങ്ങളിവിടെ മാഹി ജനറൽ ഹോസ്പിറ്റലിൽ RBSKന്റെ പാർട്ടായിട്ട് 3 വർഷം വർക്ക് ചെയ്തിരുന്നു. അപ്പൊ ഞങ്ങളെ കൂടെ ഉണ്ടാവുന്ന കാലത്ത് ഞങ്ങളുടെ പ്രിയപ്പെട്ട ഒരു സ്ഥിരോത്സാഹിയായ സഹപ്രവർത്തകയാണ്. അവര് തന്നെയും യോഗ ക്ലാസ്സും അതുപോലെ അഡോളസെന്റ് ഗേൾസിനുള്ള അവയർനെസ് ക്ലാസ്, ഇതുപോലത്തെ ക്ലാസ്സുകളൊക്കെ സ്കൂളിൽ കൃത്യമായി കണ്ടക്ട് ചെയ്തിട്ടുണ്ട്. ആ 3 വർഷം ഞങ്ങൾക്ക് വളരെ നല്ല സേവനമാണ് ഡോക്ടർ തന്നിട്ടുള്ളത്. അപ്പൊ അത് മാത്രമല്ല, ആരോഗ്യപരമായ കാര്യങ്ങളിൽ സ്വന്തം ജീവിതത്തിൽ പകർത്തിയിട്ടാണ് അവർ ഞങ്ങൾക്ക് അത് മാതൃകയായിട്ട് നിന്നത്. ഇപ്പൊ ഡോക്ടറിന്റെ ഈ ക്ലിനിക്കിന് ഇപ്പം തുടർ പഠനത്തിനായിട്ട് ഞങ്ങളെ വിട്ടുപോയി. അപ്പൊ അതിനുശേഷം തുടങ്ങുന്ന ഈ ക്ലിനിക്ക് ഡോക്ടർ ക്ലിനിക്കൽ പ്രാക്ടീസിൽ നിന്ന് വിട്ടുപോയിട്ടില്ല. എല്ലാ സമയത്തും ക്ലിനിക്കൽ പ്രാക്ടീസിൽ ഉണ്ടായിട്ടുണ്ട്. ഈ സമയങ്ങളിലൊക്കെ തന്നെ ഈ കഴിഞ്ഞ 3 വർഷക്കാലവും സ്ഥിരമായിട്ട് പ്രാക്ടീസിലുണ്ട്. എന്നിരുന്നാലും ഇപ്പം തുടങ്ങുന്ന ഈ ക്ലിനിക്കിന് എല്ലാ ഭാവുകങ്ങളും എല്ലാം നല്ല രീതിയിൽ പോട്ടെ എന്ന് ആശംസിക്കുന്നു. കുറെ പേർക്ക് ഡോക്ടറുടെ സേവനം കിട്ടട്ടെ. താങ്ക് യു. Thank you, doctor. Thank you all.
Thank you, Sriko, for your valuable time.
Any closing notes, Roshitha? Roshitha, anything to say? Closing notes? Anything?
Hello, Shakti Anna.
Yeah, I can.
Take vote of thanks was said early. So I thank everyone for your valuable time.
Yeah, please continue. You are audible.
Yes, that's all, Anna.
Okay. So from my side, I would like to thank everybody, especially the doctors, for sharing their time with us. And thank you all the participants for being patient throughout the session. And thank you very much. We will meet again soon. Shall I end the session?
Yes, Anna.
Thank you all.
Thank you all.
Thank you, Roshi. Bye.
Bye.
Thank you, everyone.